Hello friends, welcome to BMH Learning. This video deals with testosterone replacement therapy test. TRT is a treatment that doctors give to males who have testosterone deficiency and are showing symptoms of hypogonadism. But to receive a definitive diagnosis, the patient has to go through TRT blood test panel, right? So, TRT blood test panel is a group of tests that measures blood markers that are frequently tested in men undergoing TRT. The blood tests must show that a person has low testosterone levels as being below 300 nanograms per deciliter. Also, the free and total testosterone test checks the level of total testosterone and free testosterone in the blood, which is tracked to optimize testosterone dosing and replacement. Further, the individual must also have other symptoms such as fatigue, breast growth, and sexual dysfunction. Apart from this, CBC is very important in this panel. In addition to conveying information about its other components, the CBC test checks the hematocrit level to ensure it is not excessively elevated by TRT. This panel also checks the total PSA level to look for prostate blood abnormalities that might be exacerbated by testosterone replacement. In addition, more advanced TRT panel also include CMP and estradiol testing. An 8 to 12 hour fast is recommended before testing. This was all. Thanks for watching.